Welcome to season 11 of the Social Work Rants podcast, providing an inside look of the social work and mental health profession, continuing to discuss social work entrepreneurship, social work being political, and the day to day aspects of the social work profession. Hope you enjoy. Hello, social workers, mental health professionals, and change agents. Welcome to another episode of the Social Work Rants podcast. I'm your host, Bash Moreno. Shout out to everybody who's been watching, listening to the podcast episodes. Continue to follow the podcast on Instagram at the Social Work Rants podcast. That is all one word. And of course, the YouTube channel, hit that red subscribe button. And shout out to everybody who's been following along. I know I missed last week. Uh, Mentally, it was not a good week. Found out I got bone spurs, multiple bone spurs in my right knee. I thought I injured myself exercising in the gym, uh, doing a leg workout, but that wasn't the case. So that totally, because I was trying to get back into the gym, and like when I get pain like this, so like I lose all motivation to try to work out at all. So that totally messed me up mentally. And last week was my father-in-law's birthday, and it was the first one since his passing earlier this year. So just took that day off, took a PTO day, just be there for my wife. Uh, so yeah, no podcast episode last week, but we back. Uh, and I want to talk about caregiving. And because recently on July 24th, a report came out from the National Alliance on Caregiving, who does amazing work. They collaborated with AARP and talking about they did a study on caregiving in the US in 2025. And I know I kind of touched on this previously, as many of you know, part of the sandwich generation, taking care of my dad and having kids of my own. But before we get started on this topic and how it relates to social work, the podcast is not to be used as a substitute for individual therapy, individual counseling. If you need assistance, call 988, call 911, call your therapist. If you have a therapist, call your psychiatrist. If you have a psychiatrist, it's okay not to be okay, but get the help that you need. And this episode is brought to you by doing business as Bass Moreno Consulting, providing financial education and counseling for people of color in the sandwich generation who are struggling with their finances while caregiving and experiencing anxiety, depression as a result of those challenges. So definitely reach out. Follow my business page, Bash Moreno Consulting. Email me if you want to do a free 45-minute consultation on your struggles with caregiving and mental health, with your finances. Definitely reach out if this is you. So take advantage of that free consultation because we'll do a lot of work in terms of what you are currently, what's your number one struggle in terms of caregiving and your finances, and how do you together we come up with a game plan as to how to achieve that. And as well, we're getting closer to Hispanic Heritage Month, so any CEOs or any working HR or social impact who are looking for speakers for any Hispanic Heritage Month events, definitely reach out. And I'll put the speaker form link in the show notes. So back to the topic at hand. Uh, Again, the National Alliance on Caregiving, in collaboration with AARP, did a study of caregiving in the US 2025. So 63 million Americans are caregivers in the United States, which is a almost 50% increase since 2015. So if you are a caregiver, do not think that you're doing it alone. You are not. I'm talking about 63 billion Americans. add that up, another 12 million together. That's how many people voted for uh, uh, Vice President Harris in the election. So there's a lot of people who are caregivers, and 1 in 4 adults are providing care for someone with a chronic or a disability condition. 1 in 4. So you're juggling with work, juggling with caregiving. If you got kids involved, or you might be caring for a disabled child. There's a lot. Uh, 4 million people are caring for children under 18 with an illness or disability, and to think that this current administration is taking away in 2026. People are going to see the effects of Medicaid being taken away. Uh, Medi- I know some states provide special Medicaid for those who are disabled. Um, the state in Delaware, right? There is a Medicaid program for disabled folks. So think of, or when you think of social work, think of all potential ways to get into policy, ways to get into any social impact type of roles in organizations. Think of um, all the different ways from a macro perspective to help come up with better policy for your cities, for your states, local, um, cities, towns, municipalities. Like, you don't have to think macro in terms of a federal policy. Think focus on like your own states, and towns and cities. There's a lot of potential for social workers, MSW students to think, more on the macro side with everything that's going to happen. Um, think of, if 63 million folks are caregivers, think how much anxiety, depression that's out because people are stressing out about being a caregiver. Think about all those older adults who need care and need resources in terms of, hey, reapplying, recertifying their Medicaid, making sure that their Medicare is stable. If they might need to apply for managed Medicare. Um, this Part C Medicare plans, because hospitals are losing contracts to these different HMO insurance companies. I know, like where I live at, Humana lost a couple contracts within the health system here in Delaware. So what I did was having to help guide, past clients that I had. All right, you need to apply for a new Medicare Part C plan. Uh, manage, I think it's called Manage Medicare, something like that. So basically, it's Part C. So they would have Part A and B that would take care of their medical needs. You see the doctor, cover hospital visits. Part D is for prescriptions, and then Part C will be a supplemental along with the Part A and Part B. So think of case managers, social workers, medical social workers who have to deal with those type of insurance companies. So there be plenty of jobs out there, and I know with everything with AI, they're going to take social work jobs. Not doesn't seem for a while because AI wouldn't be able to like do the day to day, have those conversations of people needed to change their plans or kind of having navigate folks how to deal with the system. 22 27% of caregivers are caregivers for folks who are dealing with Alzheimer's, dementia, or another memory-related impairment. A lot of there's a medical model called PACE, is for all-inclusive care for older adults. So you have speech therapist, OT, PT, nurse, social worker, home health aide. There's a day center. So everybody comes together to basically has an interdisciplinary team to come together to deal with the medical issues of the clients or the participants that are part of that program. Um, there's two such programs here in Delaware. I used to work for one in New York uh, during the pandemic before I moved to Delaware. So I'm quite familiar with those type of programs. And there's good and bad with everything else regarding these type of PACE programs, but that's another way for you know LMSW folks uh, who have their MSW be able to work in those type of programs. There's at least a couple of those programs in New York where I'm from, um, and there's I think there's like 33 states who have a PACE program. So is a program that was getting traction into getting into more states. It's more cost effective, or it's supposed to be. So that's another avenue for folks to get into if they want to do medical social work and the whole gerontology geriatric population. Uh, there needs to be more like certifications in grad school programs to work with that population because people are living longer. The between all the medications, all the medical breakthroughs, people are living longer, and unfortunately, our systems that are in place are going to get cut. But there's a potential opportunity for folks like, hey, I need a job, and where can I work at, or not think right away I'm going to make like 75,000 off the bat with newly graduated. Um, and you could work at those type of places without needing your license, at least not initially anyway. You might have to get it eventually, but there's ways to at least get your foot in the door and work for a number of years and then go get your license after the fact. If that's what you choose. So here's my bread and butter. Uh, what I do, my business. Nearly 1/3 of all caregivers care for both an adult with disabilities or complex medical conditions and have a child under 18. Uh, 40, 47, 47% are known as the sandwich generation. And African American and Latino Latinx caregivers are more often in the sandwich generation caregivers. Many of that is just part of our culture. Like many of us live in multi-generation type households. My household is myself, my dad, my kids. So that's three different generations. Um, Again, there's many of us out there who got living with grandparents and then like maybe our parents or like grandparents and got the kids and got yourself. So 47% are members of sandwich generation. So if you didn't know what a sandwich generation is, as of this episode, you would know what uh, a sandwich generation consists of. And I'm glad when I went to FinCon last year, I didn't have to explain what sandwich generation was when I told people what I did. Like it was great. But again, all that to say, the opportunities are there for social workers to work with this population, um, not only with direct practice, but also on the policy side, to, and start planning ahead of what 2020, at least like towards the last quarter of 2026, what that's going to look like as people start losing coverage. That's also a weird time, for seniors who not only potentially have to deal with possibly losing Medicaid if they're eligible for Medicaid, and plus potentially doing um, the Part C plans, and if they don't qualify, they who knows if Obamacare, ACA, Affordable Care Act plans are even going to be in existence by that time, because I know the administration has been wanting to get rid of the ACA for a while and having a hard time with that. So, um, yeah, it's a lot to think about, and if you might drive yourself crazy, thinking about uh, what potentially could be a disaster in the making in terms of the healthcare system and people losing their coverage, and folks who bill Medicaid, bill for Medicaid, Medicare services. I would suggest start planning on what to do if you're banking on that income and that income might not be there. What are you going to do as a business owner? In private practice, or you work at a organization that gets Medicaid funds. No hospitals are going to be affected, so it's a lot to think about. So, and that's how we do what we do in social work, to manage these systems and help folks navigate these systems, because the systems is always changing and not for the better. And again, there's a lot to think about, but there's a lot of potential to work in with the geriatric population, and deal with these policy changes, and actually create policy to actually help folks and not uh, hurt communities. Because at the end of the day, a lot of these changes that are coming is going to affect a lot of Black and Brown folks, and it's definitely going to for poor uh, white folks who are going to feel the pain as well. So, um, and people are already starting to feel some of the pain already. So, and it's only going to get worse. So, before we get better, that's all I got this week in terms of the topic at hand. Again, continue to follow the podcast on Instagram. Hit that red subscribe button. Oh, there is uh, the T-shirt I'm wearing. I'm finally going to release the line of T-shirts. This is going to be is this shirt, and plus the throwback without my picture, my face, and the logo. So that's coming out soon, in a few weeks. I'll make a formal announcement. Well, this is the the informal announcement first of yes, sir. Interested in the podcast T-shirt is coming soon, and then be working try to get the hoodies popping off as well for the fall. So until next time, talk soon. Peace.